Before I start, let me take you back a little bit to June of 2012. The United States Supreme Court decided that the federal governments could not mandate states to expand their Medicaid programs. That was an unexpected decision across the country. And in Tennessee, we decided to take the time to evaluate our options and decide what was best for our state. In March of 2013, up in the House chamber, I announced that Tennessee would not expand our Medicaid program. Expanding a system that, in the president's own words, was broken, I didn't think made sense then, and nor do I think it makes sense now. But I also didn't think that flat out saying no to accepting federal dollars that Tennesseans were paying for, that were going to other states and that could cover more Tennesseans in need of health care coverage, made sense either. So we started the work to find a third way for Tennessee, a Tennessee plan. A plan that would leverage those federal dollars to really begin the work of fixing what is wrong with our healthcare system, to better align incentives for providers and consumers. Regardless of where you are on the political spectrum, I think you can agree that we're not going to contain costs in our healthcare system until incentives are better aligned than they are now. We saw the opportunity to bring providers to the table to improve the way we pay for care, to move from fee-for-service, volume-driven structure, to an outcomes, value-based approach to how health care is paid for in our state. As we saw an opportunity for more Tennesseans to be covered in a way that also made them active participants in their health and rewarded their healthy choices. I'm here today to announce a plan to do just that. It's called Insure Tennesse, and we reached final agreement with HHS just this last Friday. After 17 months of hard work, we will be presenting a plan to the General Assembly next year that addresses health outcomes and costs. It's an alternative approach that forges a different path and is a unique Tennessee solution. Here's how it will work. Insure Tennesse is a 2-year pilot program that will not create any new taxes for Tennesseans and will not add any state costs to the budget. The Tennessee Hospital Association is committed that the industry will cover any additional costs to the state. The program will automatically terminate in the event that either federal funding or support from the hospitals changes in any way. What this means is that Tennesseans who are 21 to 64 years old, currently not covered, and earn up to $16,100 a year, that's 138% of the federal poverty level, they will have 2 new options for health care coverage. The first is called the volunteer plan. It will provide a health insurance voucher to participants that they can use to participate in their employer's health insurance plan. It's our belief that over half of the folks who would be covered by this plan are currently working. They just can't afford to be in their employer's health insurance plan. This voucher could be used to pay for premiums and other out-of-pocket expenses that are associated with private market insurance plans. The second is called the Healthy Incentives Plan. Participants in that plan can choose to receive coverage through a redesigned program of TennCare, which would introduce healthy incentives for Tennesseans, or HIT accounts, modeled after health reimbursement accounts, which can be used to pay for a portion of required member cost sharing. Insure Tennesse introduces personal responsibility and patient engagement through choice, incentives, and co-pays. Members will have the ability to be reimbursed for out-of-pocket expenses through making healthy choices like preventive screenings. You know, I'm excited to be here today announcing this. As you all know, we've been working on this for a long time, and a lot of folks on both sides never thought that we would come to an agreement. But there's a lot of work ahead to make Insure Tennesse a reality. We've received verbal approval from the Department of Health and Human Services. I look forward to working with the people here today and all across this state that understand what this plan can mean for hundreds of thousands of Tennesseans. I look forward to working with members of the 109th General Assembly. After they reconvene in January, I plan to call a special session for them to consider this plan. I believe something this important to so many Tennesseans should have a full discussion and its own focus. We will also submit our plan to the federal government in the form of a waiver, which is what has to happen when a state proposes to do something different. Sorry about all the feedback. But let me just conclude this way. Some might ask, why is a conservative Republican announcing that we are going to do this? In all of the discussion that we're having about health care across the country, no one has ever argued that we are going to end Medicaid. At least I don't think people are out there arguing that. There's discussions about the Affordable Care Act, but the discussion about whether Medicaid should go away has not been on the table, and I don't think should be on the table. Medicaid was created to provide a safety net for our most vulnerable citizens. The discussion has always been, how do we do that in a responsible way, responsible to the users of the service and responsible to the budgets that are impacted. It's our hope that Insure Tennesse plan opens the door in the future for innovation within our existing Medicaid program. We want to incentivize and support Tennesseans to be a part of the solution. Too many of our healthcare costs in Tennessee and across the country are based on poor health habits and choices. To me, it's never been a question of should we provide compassionate care for people, but more a question of how do we do that in an effective way. I truly believe that the Insure Tennesse plan can be a catalyst of fundamentally changing healthcare in Tennessee. Again, I want to thank those folks that have joined me here today. We have a lot of discussion to come, and that's a good thing. This is a serious issue that is being dealt with in different ways across the state. We think we have a plan in Tennessee that fits our citizens and also is an answer to budget challenges that we would face in the future. With that, I will stop and I will take questions from any media members who are here who would like to ask something. Yeah, go ahead.
You said the Hospital Association is committed to handling the
any
costs. How do they do that?
So the thought is obviously for the next 2 years, 100% is still paid for in the federal max. The Hospital Association has agreed to increase the assessment on themselves that would pay for the difference in that. Good day.
Governor, how is this plan different than the Medicaid expansion plans that the 28 other states have already embarked on?
I think two things. Like I said, first of all, we're really hoping a lot of people will take the option of taking the voucher to buy into their employer's health insurance plan. If you think about it, in any of our safety net programs, whether it be SNAP or TANF or Medicaid, the hope is that folks won't stay on that plan forever. And some people understand the frustration of going back and forth between TennCare and employer-sponsored plan and back to TennCare. What we would like to do is have the ability for them to be bought into their employer's insurance plan that they can't afford now, and hopefully to stay there as they progress their way up in the company. Hopefully that changes, and as they earn their way out of being on Medicaid, they can stay in the same plan that they're in. So that's the first. The second piece, what we're calling a healthy incentives plan, we think has the right incentives in there for healthy behavior, both deductibles and co-pays, but also the ability that if you make wise personal choices, you can get your out-of-pocket expenses reimbursed to you. Yeah, Richard?
Governor, you said it's a 2-year pilot program. What happens at the end of 2 years, and also how soon do you, if the legislature approves it, how soon do you think Tennesseans to get enrolled?
I don't know the answer to the second question. We're working on that, and Darren Gordon can come up in a minute and answer specific questions like that. We don't know exactly how long it will take for folks to be able to be enrolled. We obviously have to have the waiver approved. We haven't submitted the waiver. We've just had verbal confirmation from HHS, so we don't know that. What was the first part of the question?
What happens at the end?
Okay, at the end of 2 years, then Tennessee would have to decide to apply for a new waiver to continue. I think the advantage is, at that point in time, we have 2 years of history, and we can see exactly what has happened.
Governor, you said you're going to call a special session of the legislature as soon as they get back. Does that mean that the plan is for 2-week recess or something on that?
No, I think the legislature would say they need the reorganization period, and so we will work with them on exactly what the dates look like. We have not confirmed the dates, so we are not assuming they can do away with their reorganization 2-week period. But I've had preliminary conversation with leaders of both houses, and we'll work hard to find the right date.
Governor, can you explain why you think a system that includes co-pays is important?
Actually, I think, and we haven't talked about this, I think what we're trying to do is drive a system that has incentives aligned on both sides. The example that I've given before, and I actually stole it from Governor Bredesen, is our current systems, like going to the grocery store, walking through, picking out whatever you want, having the manager of the grocery store assist you because they'd like the additional sales, and then you get to the cash register and they say, have a nice day. Well, nobody can argue that that's the way to align incentives for an effective plan. So what we're doing is making certain that whether you're the user, that you have incentives for making healthy choices, or you're the provider, that you're focused on outcome-based care. And I should say at this point in time, our provider community has been incredibly helpful in helping us move toward, again, an outcome, value-based approach rather than just a fee-for-service approach. One or two more? Anybody?
Governor, have you talked to the legislature at all, if you're the leaders in this?
I've spoke with the Speaker and Lieutenant Governor and the two majority leaders last night, and we're in the process of calling people this morning, legislators, to let them know how the plan will work. We realize there's a lot of discussion. I didn't ask any of them for their commitment, and it's not time to do that. It's time to roll out a plan and what it would look like. One last question, anybody? You always get in danger when you ask for one last question. Okay, well, look, obviously this is something that will merit a lot of discussion going forward. We intend to make certain that we provide all the information we can to both legislators, to the provider community, and other folks who are interested in this issue. In the meantime, I do want to thank folks who have literally come from all across the state. We have lots of elected officials here as well, and we appreciate them being here today. Thank you all very much for joining us.